For those of you who don't know me, my name's Melissa Fox and I'm lucky enough to be General Manager of Health Consumers Queensland. Thank you so much for coming along today. We know it's a long day, but we hope it's been a rich and rewarding day. So this last session, we hope that it'll be a bit entertaining, a bit controversial. We thank all of you who submitted questions to our box out the front. We did get quite a few, I think about 30 questions, but we did go through and pick out the most wicked questions of all. So before we get started, I'll get our panel to very quickly tell you who they are, where they're from and what they do, and in one sentence tell us why they're passionate about consumer engagement, why they're here today. So Michelle?
Great. Michelle McAllister, I'm from PHN, Central Queensland Wide Bay Sunshine Coast. I'm the Community Integration Coordinator. It's a sentence about why we're passionate about consumers, because the consumer voice tells us lots of stuff we don't know and how we can do stuff better. Well done.
Hi, I'm Christine Petrie. Probably most of you heard me this morning from Metro North Hospital and Health Service, the Manager of Consumer and Community Engagement. And that's, the Kelly one, there's lots of reasons, but I'd say ditto if I could. For me, it's about, I'm really interested in communication and how you connect with people. And so that's what drives me to be in this role, is to think of really creative ways of doing that and to implement and to embed that in strategy.
Hi folks, I'm Darlene Cox. I work at Healthcare Consumers Association in Canberra, which is the equivalent organisation in the ACT as Health Consumers Queensland. At night time I sit on a number of different boards, and in fact at the moment I'm on the executive of ACOS, Australian Council of Social Service. I got involved about 20 years ago in the consumer movement as a result of a number of adverse events, and quite honestly what guides me is that workers go to work every day in the health sector and it is their jobs, but fundamentally it is about our lives. So we must have a role in shaping the services we use.
Hi, I'm Helen Mees. I'm a consumer. I live out in the Ipswich West Moreton area. And I guess I'm passionate about it for just that. This is my life that we're talking about, or the lives of my children, and I will do everything I can to make a difference and influence my outcomes.
Hi, I'm Aidan Black. My role, I currently work at the Holy Spirit Northside Private Hospital, and my role is the Patient Experience Manager. So I look at all the feedback coming into the hospital, and also I oversee the Consumer Advisory Program. I'm very excited to be in this role. I came from the public system, both in the acute and primary care. However, I've been heavily involved in managing feedback for a long time, and I guess I recognise that sometimes the feedback, how we were managing it, was quite tokenistic. So, I'm passionate about translating that feedback into actual actions that will make a difference.
Hi, I'm Gabriel Quilliam and I'm one of the co-founders of Hummingbird House, Queensland's only children's hospice that is about to open in the next couple of months here in Chermside. Why I and our team are so passionate about consumer engagement is because it actually works, and Hummingbird House is a beautiful example of it. From 5 years ago, we've had both Senate and parliamentary inquiries where we supported families providing consumer comments, which triggered government recommendations to build Hummingbird House, which then triggered government funding and incredible philanthropic support. And it's all because families have been given a voice to say what they need here in Queensland.
And I feel like the token male on the panel, but anyway, with my esteemed colleagues. No, my name's John Wakefield. I'm a doctor by background. I'm currently the Deputy Director General for Health, leading the Clinical Excellence Division, which is a bit of a mouthful, isn't it? My clinical background is really as a GP and emergency doc, and spent quite a lot of years with cradle to grave medicine in a place called Gingin in Wide Bay. Why am I passionate? Why am I here? Why am I passionate about consumer engagement? First and foremost, because we know that when consumers are properly involved and engaged in their healthcare, we get better outcomes. They're happier, the staff are happier, and importantly, healthcare is more efficient. I mean, why would we not? But I think the main thing for me is, and particularly where I am in the health system at the moment, my sense is that over the last 20 years, we've become very good at being a health treatment system, and we've totally lost the ability to be a healthcare system. And I think that whilst we expect the best treatment, I think we've really got to get back to basics. And I'll be very happy when every interaction starts with, what matters to you as a question. And I'm sure, so that's my passion, and that's what I'm trying to influence from where I am in the system.
Great. Well, thanks, everyone. We received a really wide range of questions. Some covered the same topic, and so in that case, we've just included one. And one of those that we received is around evaluation, and I'd like to put this, first of all, to Christine. So if the time could start now. Sorry, can you let us know, Georgina, just give us an example of what will be happening after the 4 minutes. So, Christine, evaluating engagement, do we need a framework and/or tools? And what does good engagement evaluation look like?
Wow. Do I really? The first part of the question for me is a no-brainer. Absolutely. And in fact, probably what I'd say, having worked in this field over in Victoria and here, since 2002, what I've really worked out is, what makes hospitals tick is performance and measurement and evaluation. And so if we're to move with the fabric of how they tick, and to influence it as well, I think that tools for measuring engagement and the effectiveness of engagement are critical. How you do it, that is that's something that I think we need to engage people on. What are my ideas? How do you measure? I was just in the cultural panel here, and I loved hearing. It was the end of it where the conversation started getting really interesting for me around how do you measure going and having talks in the park with the Aboriginal community around what's important for them as health service providers. That's totally stepping out of a provider's comfort zone and what we would traditionally do. How do we measure the impact of that conversation and the ongoing conversations after that? So I don't have the answers to that, but I think we need to start asking them and to start looking at that and exploring it. We also, lots of the people that I work with talk about how clinicians are driven by metrics and numbers. And while I totally respect that, I also think that it's a balance between that and the qualitative information, the stories. They can be extremely powerful. And this morning in the conversation, in the presentation, it was like you don't need huge numbers to actually. By listening to stories, you can learn a lot, and it doesn't have to be a lot of stories. I'm going to ask my other panel members, because I think there's so much expertise on this panel to answer that question. Is that okay? Can I defer?
Thanks, Christine. Well, who's got the answer?
Come on.
At Healthcare Consumers Association, we're quite involved in evaluation of projects, programs, and it's about capturing that consumer voice and what makes a difference. What surprises me constantly is the immaturity of many health services around evaluation. While there is a lot of rhetoric that health services and professionals love measurement, well, I have to say it's a little variable as to how well you do that. And please don't forget the baseline. Otherwise, how do we know what difference that has been made? Because what we as consumers want is to make a difference. We want to improve services for ourselves, our families, our communities. And if you measure it, fantastic. But if you don't have a baseline, how can you then come back, close that loop and tell us what you've done for us?
What she said.
Thanks. I'm not sure whether it's because I'm now supposedly a bureaucrat, but I often get I often go cold and have night sweats at the thought of more frameworks because I just think there's so many things, there's so much investment, well-intentioned investment that goes into creating, the shiny document which just never sees the light of day. So I don't think it's not about not thinking about that, but I guess what we all want is we actually want to see action. We want to see things happen, and so I think we shouldn't talk framework without talking strategy, without talking implementation, without talking action. And it's true to say that the world is full of metrics, and if you don't measure it, it's not gonna reach that sort of the CEO's desk, or the CEO's bottom's not going to be on fire about it. So I think I'm not saying that's not important, but I think the consumer movement, sometimes the change can only come from you. And I coming into this job, what's evidence to me right now is when I go online and try and find anything useful out about the quality of service in whatever metric of any hospital or health service across Queensland, or nationally for that matter, I just can't find it. I can't find it in a way that's comparative. I can't find it in a way that's meaningful to me. And it's one of my 4 kind of priorities to change that. And so, will you help me change that?
Yes, we will. So I think that leads really nicely onto the next question, and this is for Aidan. So one of the attendees has said that today has showcased so much promise and amazing examples of positive improvement, but to them a huge obstacle is the doctors and the surgeons and the power structures. So I guess through consumer engagement, how do we tackle this? How do we remedy that power imbalance that might be occurring on committees or other engagement mechanisms? And how do we get buy-in from that group of clinicians?
It's a good question, and I'm not sure I have the answer. However, from my experience, I guess it's finding the champion. And having worked both publicly and privately, there are champions out there. I think, first of all, doctors, and I speak generally, are driven by data and evidence. They come from they're terribly busy people. I suppose we're all busy. They do have the best interest of the patient at hand, and their training to date has been sort of fairly conventional. So I think you've got to keep that in mind with them. I recently invited our own medical director to our consumer advisory committee, as I had worked out that actually he hasn't met my group yet, and he's relatively new to the position, but he was very excited about the opportunity, but equally had very little information or background on consumer engagement. So I think I've won him over in terms of understanding that the voice of the consumer does matter. However, it's a slow and a long journey with I guess transcending the medical group. I think, again, identifying a champion. In small ways, they do well in terms of some elements of consumer engagement, but I still think they've got a long way to go. But it's up to us and you, the consumers, to drive that. Even from a nursing point of view, I'm a nurse by profession. I've intrinsically always been interested in this area, but I have my own challenges with the nursing workforce as well. So it's about buy-in at every level. And I suppose ultimately we all become a consumer of the healthcare system, so it's up to us to slowly but surely change that. Any other comments from the panel?
You'd be surprised to know that I have a comment. As a doctor, I can say this because I'm one of the tribe. I have a couple of comments. The first one is that I have a great sense of optimism for the future. And I'll just tell you a little story about. So on Anzac Day weekend, I was part of a faculty that that taught what was called emerging leaders in patient safety, and there were 10 junior doctors, there were 10 nurses, and there were 10 medical students. It was based on an American, the Telluride model, if you want to look it up. And after spending the 4 days locked on Manly Q Station with those guys, I have a great sense of optimism. And one of the mantras that I think is probably worthwhile thinking about is, regulate the old and educate the young. So, I mean, in some respects, once the die's set, it's pretty tough. I totally agree, there's still some great people out there that you need to latch onto. The second comment, though, so optimism for the future. I mean, I think our new generation of clinicians is far better than we are. I think, though, the other thing is that I would encourage you, just as I've spent quite a bit of my time with my team training and teaching empathy and empathic communication skills through open disclosure and other things, where you think clinicians will be expert communicators, but actually, really, in some respects, they have had no training in empathic communication. I think I would also suggest, if you, as consumers, and particularly as active consumers wanting to make a difference, part of the thing that I would argue that you need to do is you've got to understand the beast that you're dealing with. And just as much as our job is to walk in your shoes, you've got to walk in their shoes. So one of the best things that you can do is yes, you've got a message, you've got things that you want to get on the table. The best thing that you can do, in my view, is to start to ask the question, what's it like to walk in your shoes? Let me see your world. Let me understand your world. Tell me about your world. And then sort of, how can I help? I can help. I can make and come in at that angle. And you've got to understand the beast, the tribe, because the tribes are very different. So there's a whole lot of literature on it, and it's actually very interesting, and a lot of it is behavioural. And don't let the doctors BS you by saying they only focus on data, and when they've got data, that's what they do, because they are no different to you and I. Most behaviour is often heavily littered with irrational beliefs. And so before the leg squeaks, there's just a couple of insights for you. Thanks.
Thanks, John. So our next question is for Michelle from the Sunshine Coast PHN. How do we encourage the entire health system to develop solutions together, so across primary care, acute hospital, community care, and with community organisations?
Piece of cake. I guess it starts with looking at pockets of where people are already engaging with consumers as well, because there's obviously buy-in there. And an example that I'll probably illustrate is one that we talked about earlier today, and that was the need for some consumer referencing around our Partners in Recovery initiative. So the Hospital and Health Service had a consumer reference group, and so we approached them and said, look, is it possible that we can do some shared referencing here, because I think we've got a fairly common agenda, and the common agenda is really transitions around care pathways, and we're all into the care coordination thing, and there was some existing relationships that made that really easy to do. Second to that, I guess it's where systems aren't already existing, and looking at how you can run some community training or some support and education to bring people into consumer referencing roles. And one of the things that we did in that instance was, with Health Consumers Queensland, we developed and co-designed, because that's the buzzword at the moment, which really is, just get together and do stuff in partnership. Yeah. And part of that was saying, well, what is it that we want consumers to do? Like, what's the expectation around that? We would like people to have to tell us what's wrong, or what we could do better in the health system. But to begin with, let's give some context and talk about what the health system is, as an establishment piece and try and explain that a little bit so that people can come into understanding Standard 2 a little bit more, can, look at ways that they can make a contribution in a meaningful way that will really be listened to and will be really respected. And wherever there is active listening, and that's part of Communication 101, I think, and authentically hearing what people are saying and then going, wow, we might be able to look into ways that we might be able to do things a little bit better than what we've been doing already. I think that's the start of getting some buy-in collectively. So PHN does that in collaboration with the Hospital and Health Service, and had a couple of people go on to some pretty high-level consumer referencing roles, sitting on quality and safety committees, sitting on the executive. I think that's a real outcome and marker of where we've been able to achieve it. But, you've got to have will and you've got to have buy-in.
Christine, do you have anything to add? Because I know that Metro North do joint planning between the PHN and the Hospital and Health Service.
Yeah, I guess we're really trying to work closely with our PHN too, and we're in the very early stages of brainstorming ideas of how we create some consumer alliances of people who are interested in similar kind of things, and particularly around navigation. That keeps coming up with us all the time. So I'm interested in actually generating momentum of people who are really interested in that space and can bring a whole range of diverse kind of perspectives to the table, to ourselves and PHN when we interact with each other. And we're actually hosting a health forum here on the 1st of June that's been a very collaborative effort between the PHN, and that's looking at, the right care in the right time, the right place, a little bit buzzwords as well, and NDIS and mental health. And that's been very much driven by what the consumers are interested in too. So it's been a good journey.
Perfect timing. All right, my next question, I'm actually going to combine two and put them to Darlene. So, often health services expect consumer engagement to occur because it's part of legislation or requirement under accreditation. But often health services don't have a budget or an adequate budget for this to happen. How can this be changed so that consumer involvement is valued, costed and financed? And the second question, which ties in, how do we engage the executive and board? How do you get that buy-in, and what levers might create that buy-in?
Who said easy? Look, we need the standards. The standards actually work as a lever for us. We fundamentally see that it's a good thing to have consumers involved. It's a moral right, a democratic right for us as the payers of the system, through our taxes, through our co-payments, to of course be involved in that. So we do need the levers. We need legislation where it's available to support our involvement. But more than anything, I would really like to have a hot date with a health economist, because so often we are so busy, the people in the consumer movement, we're so busy building relationships, building goodwill with all of the people we work with on a daily basis, that we forget to actually step back and think, what are we saving the community in terms of dollars by building people's health literacy, having people understand more about the health system, how to ask questions, be insistent on our doctors and nurses and allied health to tell us stuff in a way we can understand. Wouldn't it be great to put a dollar on that? So then it makes it easy. You go to the boards, you go to the exec to say, if you do not engage with us in a meaningful, respectful way, it's going to cost you in unplanned readmissions. It's going to cost you in medication errors, whether it's, we'll take the wrong pill 3 times a day instead of one pill every, when we fancy it really. But there has to be a way we can turn it around. And I think a marriage between public health, the consumer movement and health economists is probably, that's one hotbed I wouldn't mind getting into.
I think when you start talking about volunteering and volunteerism, everyone recognises that it's valuable. But there's a real challenge for people to actually cost it out and say, if we didn't have those volunteers, whether they're consumers on committees or whether they're volunteers in a hospital handing around books and helping with meals, what would it cost us to have them? That sort of work is starting to happen, and I think we really need to do that.
John, I know that you've done a lot of work around how to influence clinician behavioural change, and I am guessing that you're aware of the internal levers within the department, such as contracting and KPIs. What would be your advice around what we should be pushing for in this area?
I think you're on the right path, to be honest. I think that the health, for good or for bad, the health system is being increasingly deconstructed into, a sort of transactional financial elements and production. And so I think you do have to, again, it's part of walking in the shoes of the people you're trying to influence. It's very, we can all have this impassioned message, whatever it is, but the best way to get across is relationship, understand what their world is like, and try and Trojan horse your thing in a way that matters. And I do think that if you're talking to chief executives and boards, I think there's two narratives. There's the cerebral, rational, cognitive narrative, which is that one, which is you'd be nuts not to do this because let's show you the evidence for this. And then there's the visceral one. The visceral one, I think it's partly. I don't think it's virtuous. You can play the virtuous card because it's ethical and it's the world will be a better place. I think it's. Do you want to be in a position where you go down a path where you're one of the health services and there's a continual stream of health services that has a health system failure? That's those stories. Those stories, Bundaberg, the Bacchus Marsh, and you name it, one after another. If you're in one of those things, you can start counting the dollars real quick, as well as your own jobs and all the rest of it. So I think there's two narratives.
Okay, thanks everyone. So my next question is to Gabrielle, and keeping in mind the amazing journey that you've been on to create this incredible service that's about to open. Someone asked, I see gaps in the system and I don't know what to do. Where do I go in the health system to suggest new services?
Yeah, so for people who don't know about the journey of Hummingbird House, basically I've got nursing midwifery background. My husband's in education and management, and we were foster carers. We had a little girl join our family who had a life-limiting condition. As we walked through that process, we recognised a gap in service, and we felt well placed to advocate for that. And I think there's a couple of things around advocacy and the consumer voice. Is one, that there's almost the opportunity of finding people that have a very strong empathy and a sense of tribe, but who are not completely overwhelmed and impassioned. And we talk about the passionate parent that can also just take that one degree of separation back to go, okay, so how do we also make this sustainable? So the first one is to find people that have an empathy, but who also have a practical approach to it. And I was going to make a comment about the financial process. For the board of Hummingbird House Foundation, we actually don't have any clinicians on the board. We have all venture capitalists, because they said, we can see the gap, it's obvious, it is a heart-wrenching community story and narrative, but if we build this and we can't run it, then there's no use having started the conversation in the first place. So that is a hard line, and I was actually talking with our colleagues. It is a noisy community space as well with charities, because there are so many good things and needy things and gaps in services. And so how do you find the right voice and the right pathway to not only make a difference but also become sustainable? The other thing we've really learnt is the idea between entrepreneurs and intrapreneurs, and this is where finding a solution to a gap can really work. Entrepreneurs are really the ones that get out there, the brainwaves, and they do it by themselves. And for good and bad, there's almost a sense of ego around that I've done this. And the opportunity then is also, the flip side of that is intrapreneurship, finding systems and organisations or like-minded people and tribes that already have things in place and working with them. And now there's challenges in that itself, because there's a lot of change management and you've got to work within processes. But the idea of intrapreneurship and addressing gaps in services and finding a voice is going, am I more passionate about getting this gap filled than I am about it being me filling that gap? And so very much it's about finding your tribe, having a bit of a step back and a practical approach, but it's also going, let's not reinvent the wheel, because there is so much, there's such a limited, my husband talks about the finite resources, but on this growth scale that needs to grow, and collaboration is all about filling the gap as well, finding people to walk alongside. And the other third thing that we have learnt as advocates and developing a service that literally fills a niche gap is, and we call it, and it's a cognitive behavioural therapy comment, it's the CURE, the CURE, connect, understand, respond and engage. So to fill a gap, you have to connect with all the people that are in that gap, and also all the people who are already trying to fill that gap. You need to understand the empathy, the tribe, both clinical and community, or whatever the versions are, the 2 or 3 or 4 different languages that sit within that gap and the needs. Your response only then comes once you've connected and you've understood. And that's sometimes for us, we actually really considered, after doing a really good SWOT analysis and a huge business plan, going, step back, do we actually still need to fill this gap? Could we maybe try and get other people to collaborate that are already doing great stuff to fill the gap? So that is when that response has to be very measured, passionate, but also practical. And that's when you engage and you actually action that process. So they're probably my 3 main learnings around filling a gap, being a voice, and getting something done.
Thank you. Well, that's taken us to time. Thank you all so much for your contributions today.